Hello dear friends, our lecture is about thyroid disorders, hypothyroidism, hyperthyroidism, sign and symptoms, diagnosis examination, treatment. At last home works. Thyroid disorders. The two main types of thyroid disease are hypothyroidism and hyperthyroidism. Both conditions can be caused by other diseases that impact the way the thyroid gland works. Conditions that can cause hypothyroidism include thyroiditis. This condition is a swelling of the thyroid gland. Thyroiditis can lower the amount of hormones your thyroid produces. Hashimoto's thyroiditis, a painless disease. Hashimoto's thyroiditis is an autoimmune condition where the body's cells attack and damage the thyroid. This is an inherited condition. Postpartum thyroiditis. This condition occurs in 5% to 9% of women after childbirth. It's usually a temporary condition. Iodine deficiency. Iodine is used by the thyroid to produce hormones. An iodine deficiency is an issue that affects several million people around the world. A non-functioning thyroid gland. Sometimes, the thyroid gland doesn't work correctly from birth. This affects about 1 in 4,000 newborns. These conditions that can cause hyperthyroidism include Graves' disease. In this condition, the entire thyroid gland might be overactive and produce too much hormone. This problem is also called diffuse toxic goiter, enlarged thyroid gland. Nodules. Hyperthyroidism can be caused by nodules that are overactive. Thyroiditis. This disorder can be either painful or not felt at all. In thyroiditis, the thyroid releases hormones that were stored there. This can last for a few weeks or months. Excessive iodine. When you have too much iodine, the mineral that is used to make thyroid hormones, in your body, the thyroid makes more thyroid hormones than it needs. Excessive iodine can be found in some medications, amiodarone, a heart medication, and cough syrups. Risk factors. Have a family history of thyroid disease. Have a medical condition: diabetes, primary adrenal insufficiency, lupus, rheumatoid arthritis, Sjogren's syndrome and Turner syndrome. Take a medication that's high in iodine, amiodarone. Are older than 60, especially in women. Have had treatment for a past thyroid condition or cancer, thyroidectomy, or radiation. Signs and symptoms. Symptoms of thyroid disease can be divided into two groups: hyperthyroidism, hypothyroidism. Symptoms of an overactive thyroid, hyperthyroidism, can include experiencing anxiety, irritability, nervousness, having trouble sleeping, losing weight, having an enlarged thyroid gland or a goiter, having muscle weakness and tremors, experiencing irregular menstrual periods or having your menstrual cycle stop, feeling sensitive to heat, having vision problems or eye irritation. Symptoms of an underactive thyroid, hypothyroidism, can include feeling tired, fatigue, gaining weight, experiencing forgetfulness, having frequent and heavy menstrual periods, having dry and coarse hair, having a hoarse voice, experiencing an intolerance to cold temperatures. Diagnostic examination. These tests include blood tests, imaging tests, physical exams. Blood tests. Blood tests are used to see if you have hyperthyroidism, hypothyroidism. Thyroid blood tests are used to diagnose thyroid disorders associated with hyper or hypothyroidism. These include Thyroiditis, Graves' disease, Hashimoto's disease, goiter, thyroid nodule, thyroid cancer. The specific blood tests that will be done to test your thyroid can include thyroid stimulating hormone, TSH, gland, and regulates the balance of thyroid hormones including T4 and T3 in the bloodstream. Most of the time, thyroid hormone deficiency, hypothyroidism, is associated with an elevated TSH level, while thyroid hormone excess, hyperthyroidism, is associated with a low TSH level. Normal TSH range for an adult, 0.40 to 4.50 μ/ml. Milli international units per liter of blood. T4, thyroxine tests for hypothyroidism and hyperthyroidism, and used to monitor treatment of thyroid disorders. Low T4 is seen with hypothyroidism, whereas high T4 levels may indicate hyperthyroidism. Normal T4 range for an adult, 5.0–11.0 Ug/dl, micrograms per deciliter of blood. FT4, free T4 or free thyroxine is a method of measuring T4 that eliminates the effect of proteins that naturally bind T4 and may prevent accurate measurement. Normal FT4 range for an adult, 0.9 to 1.7 ng/dl. Nanograms per deciliter of blood. T3, triiodothyronine tests help diagnose hyperthyroidism or to show the severity of hyperthyroidism. Normal T3 range, 100 to 200 ng/dl, nanograms per deciliter of blood. FT3, free T3 or free triiodothyronine is a method of measuring T3 that eliminates the effect of proteins that naturally bind T3 and may prevent accurate measurement. Normal FT3 range, 2.3 to 4.1 pg/ml, pictograms per milliliter of blood. Thyroid antibodies, these tests help identify different types of autoimmune thyroid conditions. Common thyroid antibody tests include microsomal antibodies, calcitonin, thyroglobulin. Imaging tests. This allows you to look at your thyroid to check for an increased size, shape, or growths, nodules. Ultrasound. X-rays. Do not use radiation. Physical exam. Treatment. Include antithyroid drugs, methimazole and propylthiouracil. These are medications that stop thyroid from making hormones. Radioactive iodine, this treatment damages the cells of thyroid, preventing it from making high levels of thyroid hormones. Beta blockers, these medications don't change the amount of hormones but they help manage your symptoms. Surgery. May surgically remove thyroid, thyroidectomy. This will stop it from creating hormones. If have low levels of thyroid hormones, hypothyroidism, the main treatment option is thyroid replacement medication. This drug is a synthetic way to add thyroid hormones back into your body. One drug that's commonly used is called levothyroxine. How long does it take to recover from thyroid surgery, thyroidectomy? It will take body a few weeks to recover after your thyroid is surgically removed, thyroidectomy. During this time, you should avoid a few things, including submerging your incision under water, lifting an object that's heavier than 15 pounds, doing more than light exercise. Homework. Can thyroid issues cause seizures? Can thyroid issues make lose hair?